The Albany State Graduate School Spotlight Podcast features the various academic programs that offer an advanced degree here at Albany State. On today's program, our guest is from the Darden College of Health Professions. She is the Graduate Programs Director and Associate Professor of Nursing, Dr. Donyal Childs. Dr. Childs, welcome to the show.
Thank you for having me.
Tell our listeners a little bit about your background as well as your current role in the Darden College of Health Professions.
Okay. Well, I received my undergraduate degree in nursing at Albany State University. Then I continued on to get my master's in nursing education at Walden University. And shortly thereafter, I decided to go back to get a PhD in public health. Once I did all of that, I also decided that it would be good for myself and family to kind of cut my hours back, not be a floor nurse anymore. And pursue my degree option in nursing education, which led me to Albany State as a professor. I came in as an assistant professor, and of course, now I'm promoted to an associate professor. And under the consolidation, that's when I became the program director for the graduate nursing program. And that particular duty entails me overseeing the three options that we currently have for our students, which is the F&P, which is one of our premier programs, and one that most set out to seek and actually become a part of. We also have nursing education for those that would like to be in the academic arena, and we have just recently begun our nursing informatics program, which we will be starting up this fall, in fall of 2023.
Now, I want to go over each one of these programs and sort of talk about their level, their degree offering. I'm assuming it's a master's.
Yes, it is a master's degree.
Okay.
So F&P stands for Family Nurse Practitioner.
Okay.
And this is actually a program that entails students to or allows students to become advanced practice nurses. These are individuals that you may come in contact with in the hospital setting, doctor's offices, and some of them even have their own practices. They are able to diagnose and treat symptoms, disease processes in the same fashion that physicians are. This is why they're called advanced practice nurses. They are allowed additional leeway and freedoms and things of that nature to actually help with our aging population and the demand that physicians see now. And with the family nurse practitioner program, it's not specialized, like in some areas where you may just have pediatrics for children or geriatrics for older, but the family nurse practitioner programs allow students to go throughout the entire lifespan from birth until death. So you are actually equipped with taking care of any population that you may come into contact with. So your options are open and they're very vast in what you can do with your degree once you receive it. And we also have what you call a postmaster certification for those that may have already gotten a master's degree in nursing and something else, and they want to come back and actually add this component onto their resume.
That's a very broad area of nursing, as you pointed out. Is that one of your more popular programs?
It is. It actually is. We have students come from all of Southeast United States, the majority of them from Georgia, Florida, Alabama, this region, but we have had students to come from as far as Arizona to enter our program when the legislation has started what we call the compact licensure agreement, which allows nurses and advanced practice nurses to practice across state lines without having to undergo any other special testing or licensure. So with this broad aspect, like I pointed out, those students and graduates are able to do so many things. As you know, there's many things that affect our healthcare throughout the day-to-day So regardless of if it's pain management, chronic diseases like heart disease, or diabetes, those students and graduates are able to accommodate and take some of the burden off of our primary care physicians and able to actually reach out into what we call our rural population so that those individuals can receive the medical treatment that they need and not have to put it off.
That particular legislation, I'm sure, increased the value of that degree. And how long has that been in place?
It actually has been in place for a while. Before, it was just considered what we call a compact license agreement between certain states within
Mhm.
the United States. So it wasn't everyone. Now, in the recent years, I think it's been in the past 5 years or so, maybe even more, because of there's such a shortage of nurses, they saw the need to allow nurses and advanced practice nurses to be able to transition
Mhm.
across state lines. And one of the biggest impacts that you may have already guessed was the pandemic with COVID,
Right.
because so many states, so many areas needed nurses to go and help with the influx of sick patients,
Right.
that one of the easiest ways was to, okay, if they have already graduated from the program, received their certifications and their licenses, then that should be enough to say they are safe and equipped to actually practice over here. As of right now, there are some states that still have not joined the compact, but there are quite a few that have, which, like I stated before, have allowed nursing students and those our recent graduates to leave Albany State and pursue their dreams of going to a different area, a different region of the country and practice. And some of them even come back once they have done their practicing to come back and actually teach at the university and share their experiences.
My next question, and this is for the nursing education. You mentioned that some may come back and begin teaching, or what would be the title of the degree needed for those individuals to pursue?
So the admission process to come into any of our graduate programs, you must have a RN, a degree in RN, whether that's associate's degree or bachelor's degree. And there are different steps you take depending on which level you have. When those students decide to come back to teach or to pursue their additional education, if they come back to teach, they usually have to have a master's degree because we are teaching different levels. We have 3 levels within the entire nursing department, which is the associate's, bachelor's, and graduate. So graduate students can teach on the undergraduate level. Most of our terminal faculty or graduate faculty have terminal degrees either in nursing or a related field. It is expected that those that come into education are able to teach across various levels. So we do have faculty members that teach an associate's degree and bachelor's degree, and then you have some that actually are able to teach across all 3 programs because they do have a terminal degree. So as of now, if you do want to come back and teach at the university, it is highly recommended, and it really is something that you would have to have a master's degree for, unless you are looking to simply stay on the clinical side. And usually our clinical instructors on the undergraduate level only have to have a bachelor's degree, and that's simply because they can teach the students the skills that are needed to conduct good bedside nursing and to chart on patients and things of that nature. However, if you want to teach on the graduate level, it is a thing that you have to have a terminal degree to teach these advanced practice students.
Now, how many students do you have kind of roughly in that nursing education program?
Nursing education, we currently have, I want to say is 8. I do have to be honest, education is not as popular as F&P, and it's simply the pay bracket.
Mhm.
Everyone pretty much knows that when you go into nursing, you usually can make a better living if you remain in the clinical aspect of it. And it's just because, the hours, the demand, and of course, it also where you live, the cost of living plays a part into it as well. But if you are someone who has a family, who needs a change of pace, who's truly dedicated to educating the future nurses of the profession, then it's definitely definitely something for you. And I have actually had several students to decide to get both the nurse educator and the F&P simply because they knew later on after they finished their clinical aspect that some point in their life they would want to switch gears and they wanted to have the option to do both. And I applaud them for doing that because it's a very stringent program, but it is greatly rewarded once you finish.
How has this impact the education portion in terms of teaching students in this program? Has there been, I guess, an increase, or has there been a shortage in nursing educators as well?
There is a shortage in nursing education as well. Just to look at the umbrella term, nursing in general, there is a shortage. So
Okay,
when you actually look at the pool of individuals that have a nursing degree, a nursing license, you have to actually take that pie or table and split it into components where you have some that still may be clinical practice nurses or bedside nurses. You have some that may be advanced practice nurses. Also have to look at that there's some that may be nurse educators, and then there are other areas of specialty that nurses can go in. So because we're pulling from the same pool and there's already a shortage, there
right.
is still an increase or an intensity or need for additional faculty nurses, advanced practice nurses. Any way you look at it, it's just a shortage all the way around.
Wow. So tell us about this third area, nursing informatics.
So recently, actually was in, I want to say 2018, the
Mm-hmm.
Board of Regents approved us for the nursing informatics program. So, and that's a big area because the actual healthcare profession uses a lot of technology.
Right,
So and nursing informatics is basically just the integration of science and the practice of nursing and how nurses take information and knowledge and are able to kind of put it in like data sets and different technological programs to make it easier to give healthcare towards patients and make sure everything is okay, for different areas like physicians, nutritionists, physical therapists. So everyone kind of has a hand in it. So with nursing informatics, that's essentially what we will be teaching the students, how to take the technological aspect of what we do in healthcare and apply it to the practice of nursing. And with that, that's how the program came into fruition. And because we saw such a big need, because it used to be, I know when I started nursing, we did everything with pencil and paper and the computer or pens, and the
mm-hmm.
computer was strictly for things like medication or putting in physician's orders so that the pharmacy and lab can see what needed to be done. But basically everything was hand documented. Now when you go to the hospital or to the doctor's office, everything is being input into a computer system and is housed and stored on the cloud or the server so that information can be pulled, even though it may be one system or whatnot that is used in a particular doctor's office. A lot of times that information is also being able to be seen so at the hospital or a different specialist that you may have to go see. So there's not a lag in requesting
Right.
documentation from one place to the other if you need to transfer care or see a specialist of things of that nature.
Well, that explains a lot. I was about to ask you, could you put that in layman's terms? But I certainly understand that now because when I go to my primary physician or sort of anywhere in this current system, which right now is being managed by Phoebe, they are constantly inputting information in what looks like an iPad, but I'm sure that's not it. They're consistently putting in information as the doctor speaks with you. And then if you get a referral, they're able to pull the same information. So it just kind of makes the process seamless. And as you said, there's no delay in different medical systems like needing to access your information. And let me ask you this, is it all in that one medical system or can it go across state
There,
lines or different medical systems?
it can actually go across state lines,
Okay.
and you will find, especially on the back end, that if you do happen to go across state lines or even internationally, different medical facilities or practices or whatnot may actually use different software or servers or things to store information. But that doesn't mean they can't talk to each other. Very rarely now you will find components or areas that won't speak to each other, where you will have to actually get like a physical copy of something to be
Mm-hmm.
put in. A lot of that stems from, different things that transpired throughout our history. And what I have to bring up is 9/11. I know it's been years, but it actually showed how our different emergency response systems and public service areas did not communicate with one another. And
Mm-hmm.
things would happen that would cause a delay. And even when Katrina came through in Louisiana, but because there was not a centralized system, there was a delay in, receiving help, receiving resources. And it kind of showed a light that, hey, this is something that we need to start implementing and putting together so that we don't have these type of situations in the future. Now, granted, it's still a work in progress and it's still evolving, but
Mm-hmm.
as you may know, and you have pointed out, by going to your primary care physician and having to go somewhere else, the way you can just go from one office to another, it has improved substantially. So
Yeah.
that is something that is continuing, like I say, it's continuing to evolve, it's continuing to grow. And so the way I see it, it pretty much, very shortly, recent future, we will be able to do that. Let's say if you're on vacation in California or something, but all your records are over here on the East Coast, they
Mhm.
will be able to pull that to see what you're allergic to, what kind of treatments you've had, so they can go ahead and treat you right then and just forward the information to your physician, your insurance company, or whoever may need it at that time.
Well, that I was thinking about that part about the insurance is this new technology, the cost for this. I don't know if this is something that you all talk about or discuss. Where is the cost of this coming from to support this type of system? Honestly.
Okay. Now, are you referring to the actual system itself throughout the country, or are you referring to the program
Well,
that students are? Because, of course, the program, the actual funds to run the program and things come from tuition. We
mhm,
currently have a graduate grant available to our students that is overseen by Dr. Ochie in Title III, that actually helps students pay their tuition so that they can take the burden off of having to work full time and
mhm,
try to go to school full time. So, as far as the program for Albany State, there are various means, through financial aid, the grant we have, and student tuition. Some pay out of pocket. And then some employers also pay for students to come back to school to receive these advanced degrees. Now, as
uh,
far as the country itself, of course, a lot of these things come from taxpayer dollars that we have to, everyone knows we have to pay taxes every tax period or pay period.
right.
So it comes throughout those measures, it comes through the national budget, things like that, that actually come down and help implement some practices depending on if they receive grant funding or governmental funding. They may have that to actually implement into their practice so that they can be on the server or in the informatics type situation where they can use the same program. And I think, if I'm not mistaken, that there are a lot of initiatives in order to get like rural America on these
Mm,
different things to update like the hospitals, just medical care in general. Because even here in Southwest Georgia, there are some areas where it may take you 45 minutes just to get to the closest hospital.
right.
And of course, they don't have high speed internet. It's a lot of things that go into it. So, with that, funding from the government and these grants and things that they can write for, they're able to upgrade their system so that they are compatible and actually help patients get care that they need in a timely manner, or at least transport them to an area where they can receive what they need.
Well, thank you. My question initially really was about the taxpayers and where the cost of this, who is it being passed on to? But I'm glad that you addressed that Albany State and funding to support the students pursuing this.
That is for the graduate nursing program in general. So regardless if the student, whatever concentration the student wants to major in or pursue, whether it's nursing education, family nurse practitioner, or informatics, they can apply for that. If they apply and they meet the criteria, then of course they're awarded. I'm not sure of all of the exact requirements, but I do inform students that you won't know unless you apply, and the worst answer you can get is no. So just go ahead and see if you can get it. So and it's no harm in trying. At least you know you tried and you received your response. So that grant is actually for all of the graduate students.
You have checked all the boxes of the questions that I had so far, so that's great. We talked about the graduate school admissions process just a little bit. So if you would, and just kind of walk us through the process.
Okay. In order to come into the graduate program, any student, they have to have what we call an unencumbered, unrestricted nursing license. So if they majored in biology and they have a biology degree, they will still have to go through an undergraduate nursing program in order to get what they need in order to sit for their nursing license. So they will still have to do that. So once they have their nursing license, they will apply to the university's graduate school. That information is then reviewed by our admissions coordinator in the graduate school office. And once everything is obtained, they have all the references, all documentation is sent over to the nursing department where it is reviewed and once we review that information and make sure that they have all of the what we call prerequisites, undergraduate courses that are required, we do what we call an assessment, an admissions assessment. We let the students know if they need any additional courses. We let them know if they have been or granted permission to come in, or if they were denied. If they have been granted admissions to come into the program, we give them what we call a program of study and a curriculum pattern so that they can be aware of what classes are needed at what particular semester throughout their matriculation. And the program of study is simply for them to check off what courses they have and keep up with their GPA. And we do that every semester, and especially around midterm, so that they are cognizant of what they are doing and what may need to be done in order to stay successful. And throughout that, once they receive all of that information and we receive it as well, we have a second application that must be completed, which is called the departmental application. And this application is basically within the department for the graduate school. And this is when the students tell us which concentration that they are seeking, whether it's family nurse practitioner, nursing education, or nursing informatics. So depending on what they, check off or what their concentration of interest is, we place them in those categories, and then we set up interviews for those students, just because it is competitive getting into graduate school. And depending on how many slots we have available, that's how many students we're able to admit during that particular semester or intake year. And that's only because we are restricted by accreditation purposes of how many students a faculty member can have and how many students a faculty member can take to what we call our clinical or practicum experience.
And just kind of on average, what is the number each semester beginning in the fall that you all are allowed to accept based on your certification?
We usually accept between 20 to 24 students every fall. into the program.
Okay.
That's for a family nurse practitioner. Of course, the numbers for nurse education are usually smaller, so we really don't have a cutoff for them, but we do happen to have a waiting list for nurse practitioner because of that ratio. But usually, our nurse educator students are able to just go ahead and go in without having to be placed on a waiting list.
How long is each program? Or
Currently,
concentration, rather, excuse me.
currently FNP and nurse educator are 2 years. Of course, the postmaster certification is roughly a year. However, we are going through what we call curriculum changes, where we're trying to optimize the time and monies of the student, the finances. And nurse educator, what we're looking to do is turn those concentration classes into A-term, B-term courses so that the students can get out in about, I think it's going to be 15 months.
Okay.
And the family nurse practitioner will be able to get out within 5 semesters. We're also looking at getting the informatics students out within 12 to 15 months.
And just to remind everyone, the nursing informatics concentration kicks off this fall 2023.
Yes, fall 2023. So if anyone is interested in nursing informatics, please feel free, to go ahead and apply, and we'll make sure we reach out to you and get the information that you're requesting out.
Thank you. And as we close, students that are interested in the program, where can they go to find out information?
Information for the graduate nursing program can be found on the Darden College of Health Professions webpage from Albany State University. From there, you will just go to nursing and you will see on that page the different programs, associates, bachelor's, and master's degree programs. Once you click master's, you will have all of the admission criteria that's needed to apply to the program. You'll have concentration information, student handbooks, a great wealth of information, and everything you could need to actually make a conscious decision about whether this is a place for you and whether or not you would like to attend. And of course, if that is not enough, you can always reach out to one of our faculty members, our graduate faculty members, including myself, Donyal.Childs at asu-rams.edu, or one of our administrative assistants within the nursing program, and they will be happy to point you anywhere in the direct direction.
And I'll spell that out. That is going to be Donyal, DONYALE.CHILDS at asu-rams.edu. Also, if you are interested in the graduate program, any of our degrees, our executive director for the ASU Graduate School is Dr. Charles Ochie, and he is located in the Billy C. Black Building on East Campus and room 292, and his telephone number is 229-500-2022, and the office is open from 8 to 5 p.m. at the 504 College Drive location. And again, that is 229-500-2022. Email graduateadmissions@asu-rams.edu. graduateadmissions@asu-rams.edu. Well, Dr. Childs, thank you so much for coming on the show and educating us on the nursing program. We've got less than a minute left, so I just want to say thank you.
You're welcome. Thank you for having me.
And as I stated in the opening of the show, each week this program will feature a graduate program offered here at Albany State University. This has been the Graduate School Spotlight, where we have focused on the nursing program. Thank you, everyone, for listening.